A recent survey found more than half of women believe gender discrimination in healthcare is a serious problem. And the author of a new book is helping women understand and take charge of their health in the new year. We're joined live by Kanwal Haq. She is a medical anthropologist and co-author of the book Taking Care of You, The Empowered Woman's Guide to Better Health. Welcome. Good morning.
Thanks so much for having me.
So there are already a lot of books on women's health. Why do we need this one? What does this one bring that's different?
So most books on women's health tend to discuss the things that are exclusive to women. We like to call that the boobs and tubes. But really, there's three categories when it comes to women's health. Those, yes, that are exclusive to women, but also those conditions that impact women more than men, and then those that impact women differently than men. And so with Taking Care of You, we cover all of those.
Okay, what is the 1 million More Women campaign?
So this year, our team is leading an educational campaign to inspire 1 million more women to better health and improve healthcare for every woman. We are partnering with like-minded visionaries all across the country to spread awareness on the gaps in women's health and what we can do about them. Women's voices are at the heart of this campaign, and we're inviting every woman to join us and share her stories and her ideas for change at 1millionmorewomen.org.
Okay, so let's talk about the substance of the book. What are we learning when it comes to the disparity in women versus men and their medical trajectories, their health, etc. We know that birth rates and problems with fertility and birth are a big issue, but what else?
So there's also, when we look at what's really killing women in the United States today, it's things like heart disease, diabetes, stroke, dementia. But when we think of women's health, those are not usually the things that come to mind. And so, for example, heart disease and heart attacks present very differently in women than they do in men. So in Taking Care of You, we've kind of broken everything down. It's all templated and it's easy to use. You just turn to the chapter you need and you'll find everything there with an illustration to explain it without the medical jargon.
And what is the barrier that creates this disparity between men and women and their accessibility? And why do women report feeling that they're underrepresented when it comes to their health care?
Yeah, so my co-author, Dr. Mary O'Connor, and our illustrator, Margot Sarkozy, and we are healthcare professionals, we are researchers, and we started looking into this, right? We found out that it wasn't until 1993 that women were included in clinical trials. And then it wasn't until 2016 that a policy came out that, women, sex as a biological variable should be considered because every cell has a sex and sex can impact our biological functions throughout our entire body. It can be small or it can be enormous, but it's really crucial to study that impact. But even today, most studies are not reporting their analysis and findings by sex.
That's unbelievable. 1993, when they first started doing clinical trials on women. And as you mentioned, there is a difference between men and women and sometimes the effects that healthcare and medications can have on them.
Yeah, absolutely. And, right now it's actually 80% of medications that get taken off the market because they have adverse side effects in women. This is completely unacceptable. So that's why we're leading this campaign to create the awareness around this and to start creating change.
So what should every woman who's watching now do today to advance their health and to take control of their health?
Get informed, learn about what you can do to get better health and healthcare right now. Get your copy of Taking Care of You. You can get it at Amazon, Barnes and Nobles, Target, Walmart, anywhere books are sold. And join us on social media at TCY Women or online at 1millionmorewomen.org to learn more. Together, we can improve the lives of women, their families, and our communities.
Okay, well, thank you very much for joining us. We appreciate having you.